Ontario is reaching out to people who have yet to be vaccinated against COVID-19 with mobile, pop-up and walk-in clinics as the province prepares to phase out mass vaccination centres in hospitals, stadiums and convention centres. Doctors' offices and pharmacies will also begin to play a larger role as the province tries to encourage people who are hesitant to receive vaccinations or who have not otherwise booked jabs, authorities said in a briefing Thursday. We will move on to that as we discover that our need for mass vaccination clinics decreases, Attorney General Sylvia Jones said at a later news conference, when Ontario reported that more than half of eligible adults have received both injections, in addition to 80% with the first doses. Hospitals, arenas and convention centers will increasingly need to return to their normal activities as the province emerges from the pandemic, leaving vaccines to traditional providers such as doctors, pharmacies and public health clinics, Jones added. No firm dates have been set for the closure of mass vaccination clinics, and clinics hosted by local health units in schools are a possibility if federal health officials approve vaccines for children under 12 years of age. Children 12 years and older are already eligible for the second dose of Pfizer vaccine. With the most contagious Delta variant accounting for nearly 82% of all new COVID-19 infections and several trouble spots under close surveillance, Health Minister Christine Elliott said the province must do more to ease barriers to vaccination. Efforts will include online multilingual city councils to reach various cultural communities, dedicated clinics for people with disabilities and youth, providing transportation for those in need, offering translation services at clinics, driving tours, and targeting zip codes with lower fees. Vaccination. There is still more work to be done, Elliott said. There is still more work to be done. Ontario reported 4 more COVID-19 deaths and 210 new cases Thursday, the lowest level since early September. Despite the challenges in convincing some to get vaccinated, Elliott told reporters that there are no plans to offer incentives like lottery prizes or scholarships to increase first doses and speed up second doses. Some U.S. jurisdictions have offered incentives to encourage people to get vaccinated. Statistics showing that infection rates are higher among the unvaccinated are incentive enough, he added. During the 6 months ending June 12, 96% or 380,135 people who tested positive for COVID were not vaccinated. The period included the initial launch of the vaccine from mid-December and the slow rise to more recent high levels. From mid-May to mid-June, 83% of people who tested positive for the virus had not been vaccinated and 15.6% received a single dose. Another 1.2% were fully vaccinated but still contracted the virus. Ontario has 11 public health units designated as hot spots for the Delta bypass, with the Waterloo, Grey Bruce and Porcupine region receiving the most outbreak attention. Authorities said the hotspots received an additional 772,000 doses of vaccines to control the spread. When asked about the third stage of the reopening scheduled for July 20 or 21, when dining at restaurants and gyms could resume, Jones said health authorities are keeping a close eye on the rapidly expanding Delta variant. The desire to open Ontario and allow as much business activity as possible must be balanced with the way in which variants of interest are moving through our communities. We saw in areas like Porcupine, like Waterloo, that historically they had not had serious problems immediately as a result of the Delta variant. While an official said outbreaks in those areas are stabilizing, the number of daily cases remains high, with the Waterloo region registering 52 new infections on Thursday. That compares with Toronto's much more populous health unit at 18. Mostly rural, Grey Bruce recorded 17 cases.